Hey everybody, it's Alicia Reiser from A Rise Above Occupational Therapy, and today we're going to look at the top 3 reasons why occupational therapy and optometry should be best friends and work together in a collaborative effort. Today I wanted to review with you my blog post, The Top 3 Reasons Why Occupational Therapy and Optometry Should Be Best Friends. I wrote this piece when I was doing my capstone, and it really resonated with me because I was looking at scopes of practice and what OT knows about vision and what optometry definitely knows about vision and how the two of us can work together. So I wanted to get that information out to you, and I wanted to also bring it to you via video for those of you who didn't find my actual blog post. But the information is in the link below for the actual blog post, so please feel free to search that out after you watch the video. But top 3 reasons why OT and optometry should be best friends. Number 1 is that occupational therapists are experts in function. So if you're an OT, you know that what we do is we look at activities of daily living, and we look at function, and we look at performance components. Vision is one of those performance components that we need to not forget about, because everything that we do pretty much requires our vision. So we want to make sure that when someone comes to us and they're reporting either double vision or blurry vision or losing their space with their reading or forgetting what they're reading, we want to make sure then that we assess that. So we want to look at those eye efficiency skills that can impact how we perform on function. Just like when we look at someone who's trying to get dressed after a stroke and they can't move their arm, we look at their arm and see why they can't perform the task of getting dressed. So it's the same thing we want to do with vision. We want to look at why they're having trouble with remembering what they're reading, or why they're having trouble in school going board to table. We, as occupational therapists, are experts in breaking down that task analysis and figuring out if there is an issue. In terms of optometry, they are the experts in vision. So we want to make sure we can screen for those vision inefficiencies, but then we need to refer on to optometry. They have specialized training in convergence therapy, in accommodative therapy, in eye movement therapy, and they know how to remediate that more so than what occupational therapists are trained to do entry level. So you want to make sure that you are referring to the right eye care professional. Ophthalmology looks at the structure of the eye. It looks for eye disease. Optometry looks at how the brain and the eye communicate. I like to equate it a little bit, PTs, please don't get mad at me, between the relationship between PT and OT. So ophthalmology is the physical therapy of this relationship, and optometry is the occupational therapy in this relationship. So where someone falls and breaks a hip, physical therapy looks at strengthening. They look at the range of motion of the joint. They look at the walking, and do they need a walker or a cane? Ophthalmology looks at, do they need glasses if they have cataracts or glaucoma or some sort of optic neuritis. Occupational therapy, going back to the example of someone who breaks a hip, looks at the functional tasks that they need to be able to do, right? We look at, do they need to get dressed? Do they need to drive? Do they need to get back to work? So we look at adapting the environment. We look at that interaction. We look at what sorts of things we can offer to help them. Optometry does the same. They look at the function of the brain and the eye and how they work together. So you want to make sure that you're referring to the right kind of eye professional. They may identify as a behavioral optometrist, a developmental optometrist, a neuro optometrist. So the best 2 places to look for this kind of information is through NORA or through the College of Vision Development. They have great references, and their links are below for treating visual inefficiencies. Those are the eye doctors you want to send to. And lastly, the third reason why OT and optometry should be best friends is a collaborative effort together can only make it better for the patient. So if they're working with optometry, doing vision therapy, or if you are a specially trained occupational therapist who is working under the prescription of an optometrist and knows and has taken either clinical doctorate classes or specific training from an optometrist, working together can only make it better for the patient by looking at function, by looking at remediation, and working together so that the patient can alleviate symptoms, have comfortable vision, and be functional. If you have any more questions, please feel free to read the actual blog post that is on our website. The link is also below. And please stay tuned for more vision videos and how OT can help.